folks, Dr. Phillip Yoo here. I am the founder of the Laser Med Knee Pain Institute, and today I'm going to show you how we are going to prescribe orthopedic wedged insoles. And what this is going to do, it's going to unload the knee joint if you have what's called a genu valgus. Genu means knee, valgus is when your knee joint is formed in an L. In layman's terms, it's called a knock knee. And what happens in that case is, let's say this is your knee joint, and if your knee is in a valgus position or knock knee, it's gonna load the lateral portion of your knee joint and cause that to go bone on bone eventually. So, to compensate for that, I've developed what's called the Laser Sports Med orthopedic insoles, and it has a 5-degree wedge. So what that's going to do is, if this knee had a knock knee, and I put that wedge in my shoe, biomechanically it's going to unload this portion of the knee. Okay? So it's going to unload the lateral part, and when you unload it, according to Wolff's Law, which is specific adaptations to imposed demands, loading the knee, it's going to cause it to go bone on bone eventually because of the compressive forces. Unloading it, it's going to provide the cartilage a chance to heal, because not only are we creating a space, but cartilaginous aggregates will start forming because Wolff's Law, we're unloading the knee, providing a space for it to heal. We've already done some laser therapy, and that promotes blood flow and platelets to go inside the knee to stimulate your mesenchymal stem cells to increase the healing response for that cartilage. Okay, so without further ado, so here we have Dr. Robert Francis, and we diagnosed his knee as a genu valgus. So Doc, if you could take down your knee brace there and show the camera what your knee looks like. Go ahead and stand up. And if you can go and take a full body angle and go ahead and put your shorts up so we can see the alignment of the knee. Okay. And you can definitely see that he has a knock knee, especially in this left leg. Okay. And that's loading the lateral knee joint. And it was diagnosed as bone on bone, correct?
Yes.
And when you do have the pain, it is on this outside when you golf and walk?
Yes.
Yeah. And so what we're going to do is we're going to unload that by fashioning this 5-degree wedge orthotic insole, and when he wears it under the foot, it's going to unload that part of the knee. And go ahead, if you lean in there, you notice how there's less strain and not as much clicking, correct,
yes,
as we saw before,
yes,
right? And now I'm going to show you how we can custom fit it for his shoes, okay? So without further ado, the great thing about these is you could take out the manufacturer's insoles of the shoes you wear.
Okay.
All right. And then you take a pen. And what I like to do, I make sure it's aligned with the fattest part of the wedge. Okay. So we let gravity put it back like this. So now the posterior, the back part, and the medial portion is in a line with the fattest part of the wedge.
Yes.
And then I could outline his manufacturer's insole. Because if you align it to his toes, it's going to be too short, because all shoes have a longer manufacturer's insole, so it doesn't slide around in your shoe and it fits in. So I went ahead and did that, and with this material, it's nice and pliable, so I'll just cut his insole according to the outlined manufacturer's insole. Alright, and we're going to leave these out because it might be too thick. We want to make sure it fits in okay. Alright? Now, when you go buy new shoes, you're going to take these and try on the new shoes with these in to make sure it fits. You might need a half size bigger. And you can switch between your shoes, put in your golf shoes. You can even make another pair if you want, okay?
Okay.
Yeah. just tell me. We can make another pair. You just stick it in your shoe. Make sure it's all the way in the bottom. That's going to feel a little weird because you do have a 5-degree wedge on this side, but you're going to adapt. So go ahead and put that on. Okay, and go ahead and walk. And how does that feel?
That feels good.
Yeah. You notice how it takes the strain off that lateral knee.
Even,
and I want,
even without consciously pressing out.
I noticed you had more power when you got up from the chair. You didn't have to use your arms or everything, too.
Right.
Yeah.
No, I can see that's going to be very beneficial.
Now I want you to mimic your golf swing. You check out. I'm going to step back here and mimic your golf swing in front of the camera.
From the side?
Yeah, from the side's fine. You see how that's going to prevent your knee from, being loaded there.
Yes.
Because you have that insole, it's going to keep it in alignment, and this is what it's designed to do. Because when you forward move the knee, it's just going to collapse sometimes, but here it's going to keep it in a neutral balance.
Yeah, right? That end of the swing is where it hurt the most, and I can feel nice support.
Exactly, because it's opening that lateral knee joint. And what I'm going to do to balance out this leg, because this is not really a knock knee, this is a neutral wedge, which is about 3 millimeters, which is the thickness of the back part of the wedged insole to balance out his hips and his feet and knees. This one is neutral because he does not need the unloading on this knee. Okay, and again, we're going to do this the same way. Go ahead and take that shoe off. And again, I take out the manufacturer's insole. This came out easy. Oh, you already had something in here. And a lot of these times you have to rip them out because they're glued in there. And this one, again, I align it laterally. Well, this is neutral. It doesn't really, as long as the back is aligned, but I like to kind of, push it to the edge. That way when you cut it out, it's going to be fit in the shoe real nicely. Again, I just outline it right here. Right, and we just cut it just like before. This is made of poron, which is a very shock absorbent material.
I wondered what that was.
Yeah, high quality.
It's going to make it a lot easier doing the wall exercise.
Yes, when you wear these.
So
even in your home, I want you to wear these 24/7 as long as you're on your feet to help unload that. And then guess what? We may get some regeneration of the cartilaginous aggregates when they open up that space. Yeah. Just like the research study we've seen. Go ahead and stick that in. And go ahead and get up and start walking around. It should feel more balanced than before.
Feels slightly like my right foot is moving slightly because the insole is not quite as thick.
Exactly, yeah.
But
it'll balance out. Because I wanted to put that in there because this one,
so that I
don't want the height to be so different.
Yeah.
But you'll adapt to that. So go ahead and do that golf swing again here now that you have both of them in. Take a full swing, full speed. Pretty good, huh? It held up pretty good.
Yeah, it did. It's the kind of thing that, I couldn't do that.
And here's the exercise I taught him to do. Let's switch spaces here. So I wanted to work on squats, but against the wall. So he would be his hands on the wall, the feet square, and when he would squat down and up, he would purposely be pushing the ground apart, pushing his knees out so they don't collapse when he's squatting, so it keeps neutral in that Q angle. The ASIS, the middle of the kneecap, the space between the big and second toe. Now I can do a full one, and he's going to be pushing the ground apart to keep that knee neutral. So for him, he's going to go down as much as he can without pain, while keeping the knees neutral so they don't collapse in to strengthen the quadriceps. Let's have you do it right here like I taught you, with the insoles in. Okay, and your hands up on the wall, back straight, just like I taught you. Push the ground apart, push your knees apart, keep on your heels. Okay, and up, stand up straight, good. Down, Good. See how it's keeping those knees neutral?
Yeah.
And let's do another one. Keep on your heels. Good. Notice with the insoles, it's easier to keep your knee in alignment.
Definitely.
And then when you're squatting, there's no knee pain?
No.
Great. Look at that. So that's the best exercise to strengthen your quadriceps, your glutes, your posterior kinetic chain, and keep them golfing and walking. So, folks, that's how we do it. Another success case. He got
wonderful.
Yeah, his laser treatment. We got more than 50% decrease in inflammation of the pain and swelling and inflammation. And now that we got the structural portion of his knee program taken care of, we're going to start strengthening now and get him back on the golf course and walking those 18 holes.
Yeah.
Right, Doc, congratulations. You're another successful case study.
Thanks a million.
All
I
right.
appreciate everything.
There we go. Here you go, folks.
Yeah.